For every woman, menopause is a significant time that involves a series of physiological changes. The series of symptoms or changes can vary before, during, or after a woman experiences menopause. The age at which menopause occurs will depend on multiple factors: race, prior ovulations, lifestyle habits, socioeconomic status, and prior surgeries all influence the onset of menopause. During this stage, a woman has an increased risk of various health complications. This week, we're covering the top 5 common health risks women face post-menopause. Let's get into the madness. Number 1, osteoporosis. Osteoporosis is the most common worry for women, as it's possible to lose 25% of bone density after menopause. A 2017 study confirmed that women are 4 times as likely as men to develop the condition. Osteoporosis is a condition that causes bones to thin, and the change in bone density can increase the risk of bone fractures. The most common areas that experience fractures or breaks include the hips, wrists, and the spine. It's wise to make lifestyle adjustments to get ahead of the condition, and you can speak to your doctor or nutritionist about the right steps to take. Number 2, weight gain. This may not seem like a health risk, but an inability to control weight can lead to other, more serious conditions. The altered hormone levels negatively impact a woman's metabolism, which can cause the body to easily gain fat. It's also common for a woman with a slower metabolism to lose lean mass tissue as well. Menopausal belly fat can be more serious than an eyesore. More fat around the midsection increases the risk of type 2 diabetes, and a recent study found that it also increases the risk of heart disease. Number 3, urinary incontinence. The tissues in the urethra and bladder contain estrogen and progesterone receptors. The tissues are naturally thickened by both of those hormones. When those levels drop after menopause, the tissue becomes thin and weak. This is why postmenopausal women can commonly experience urinary incontinence. Stress-related urinary incontinence is quite common, and it can occur when sneezing, coughing, or during physical activity. Some research, however, states that urinary incontinence is more of an age-related problem than a postmenopausal issue. That being said, many researchers claim that estrogen plays a role in urinary incontinence. Number 4, cardiovascular disease. It's common for women to think that breast cancer is the biggest threat to their health, but life after menopause involves a serious risk of cardiovascular disease. According to the American Heart Association, about 1/3 of women develop cardiovascular disease. The risk of heart attack increases for women about a decade after menopause. One of the primary reasons for this is because estrogen levels drop. Estrogen maintains blood vessel flexibility, helping vessels contract and expand to aid optimal blood flow. This flexibility diminishes post-menopause, which can cause a rise in blood pressure and thicker arterial walls. You can take control of this by following a heart-healthy diet, quitting smoking, and exercising regularly. Number 5, urinary tract infection. The decline of estrogen after menopause can cause vaginal tissue to become dry and thin. This occurrence can make it easier for bacteria to thrive, which increases the risk of urinary tract infection or UTI. Ultimately, a woman's risk of a UTI will depend on individual lifestyle factors. A 2019 study found that the risk of UTI doubled for women over age 65, and 10% of postmenopausal women reported a UTI within the past year. While UTIs naturally increase with age, overall health can increase or decrease the risk of getting one. At Dherbs, we want you to be mindful of some of the bodily changes and potential health risks for postmenopausal women. That's all for this week. Drop a comment below. Tell us how you really feel. See you next week for another Dherbs Weekly Top 5.